All right, moving on. For a long time, Kenya has been operating without laws on surrogacy and assisted reproductive health. Matters like in vitro fertilization, also known as IVF. Now, Suba North Member of Parliament, Odhiambo, is reintroducing the bill, the Assisted Reproductive Technology Bill 2022, and the Family Reproductive Healthcare Bill to be debated in Parliament. If enacted, the bill should see the country have a solid framework on how women facing infertility challenges get help and comprehensive sex education among the adolescents. Beldin Waliola with more.
The Assisted Reproductive Technology Bill 2022 and the Family Reproductive Healthcare Bill 2022 are not new bills to the floor of Parliament. After failed attempts, Suba North Member of Parliament Odhiambo is ready to see the bills this time round ascended to law.
The second bill deals with the support of women who are struggling, women and men who are struggling to have children naturally, and the Assisted Reproductive Health Bill seeks to help them using medical systems to get their children. The other reproductive healthcare bill is a bill that deals with the reproductive issues that affect both men and women. It takes a life cycle approach, meaning it looks at the entire spectrum of life, our reproductive life.
Through the Assisted Reproductive Technology Bill, Millie says men and women who are struggling to have children or have reproductive challenges will have the ability to leverage available technology, as the country will have enough laws and framework to guide them.
But then what happens? You take a stranger, they take the child for you, and then they refuse to hand over the child. After the birth, they refuse to hand over the child. There is no law. Yeah, first of all, now you are going to the next level. Hii amekataa, so you are adopting what na amekataa.
You know, tuko na shida. This LGBTQ thing, it has made so many good laws even die when they shouldn't. And the church will be up in arms, or when it is a social adoption or a social arrangement, then we'll have gay parents having surrogates to carry their children. We must get somewhere that we don't, in our advocacy, we make it very clear that it is not touching, because that is the one issue in the 12th Parliament that contributed a bit of the contention when it shouldn't exist.
The Assisted Reproductive Health Bill will look at an array of issues not limited to IVF, egg donation, sperm donation, embryo rights, surrogacy, rights of donors, and the child born out of the assisted reproductive technology.
We have women who are also facing similar challenges, including menopausal issues, but because they have not been dealt with in the law, we are not able to address them. Unfortunately, and I want to encourage our religious leaders that whenever you hear about reproduction, it is not about abortion. It is about the entire spectrum of reproductive life.
In a meeting with the stakeholders that included non-governmental organizations like KTN, the Cradle, IPAS, members of parliament and senators, the nitty-gritties of the bill was discussed and how to better improve the clauses that saw the bill not sail through in the previous attempts.
We actually introduced an amendment to the Birth and Death Registration Act to essentially give notice to the registrar that surrogates should be recognized, intended parents should be recognized.
The Family Reproductive Healthcare Bill has been vouched to be key when it comes to reducing teenage pregnancies, pregnancy terminations, and even maternal deaths. The bill has provisions ensuring all women of reproductive age, that is between 12 years to 49 years, have access to reproductive education and information, have access to quality reproductive health facilities. Teenagers have access to adolescent-friendly healthcare services and facilities. The reproductive healthcare of men and intersex persons has also been extensively covered in the bill.
Afya ya uzazi inaanza ukiwa mtoto na haiishi mpaka ukakufa. Hata wakati unafika mahali umefika huwezi kuzaa, bado afya yako inaendelea.
Education should not be an issue that should be left to the country, or rather to the government, to deal with. It is not an issue that should be left entirely to the church.